right, 8 minutes after 11 o'clock. Thank you for tuning in. I did not have a chance to chat with our next guest to get the pronunciation of his name. So before I say anything, let me apologize because I'm probably going to say it wrong. The book, however, I think I can pronounce this. The book is called Take Back Control. It is a surgeon's guide to healing your spine without medications or surgery. Dr. Kamshad Raiszadeh is on the phone, and he's going to correct my pronunciation in just a moment. He is a spine surgeon. He's the designer and developer of Spine Zone, which is a program to prevent unnecessary surgical procedures and medications, which is really what we want. Surgery is a blessing, but if we get better without surgery, we all want that, don't we? And the website, at least one of them, is spinezone.com. I think there's another one. Doctor, thank you for, I'll just let you say your last name. Good morning, doctor. How are you?
Good morning, and you did great on the pronunciation. Raiszadeh is perfect.
Oh, my gosh. Okay, well, thank you. God, I never get it right, but thank you for telling me that. All right, so where are you right now? Where are you calling from?
I'm calling from Colorado, actually.
Oh, okay. How's the weather?
It's wonderful.
Yeah? You ski?
Yeah, just getting ready to go skiing later today.
So I'm guessing skiing, to parlay into the topic at hand, I'm sure skiers end up showing up at the hospital with some back injuries quite often?
You know, down in San Diego, the main issue we see is patients with back or neck pain. A lot of times, not necessarily being very active. A lot of people who have desk jobs. There are folks who have strenuous jobs that also end up coming to this with a lot of back pain, neck pain, and also there are folks who the back pain has a major kind of psychological component too, and there's a lot of folks who are on a lot of chronic medications and who've had surgery that have failed. So we see a lot of different types.
Can I ask a definition question? This is maybe Spine 101. Is when we say the spine, are we referring to the bones, the spinal cord, or both?
We're essentially referring to everything having to do with the spine. So meaning the discs, the vertebral bodies, the nerves, the whole complex, even the muscles. We're talking about the muscles. We're talking about the whole complex that's our core. Essentially, it's the core of our bodies.
A long time ago, when what was the guy who played Superman? Christopher Reeves. When you remember the Christopher Reeves accident where he fell off the horse and he became paralyzed from his neck down? Yes. I remember there was a doctor on the news saying that our spinal cord is as fragile as a piece of spaghetti, a wet piece of spaghetti. Is that accurate?
It is very sensitive, but the problem is also it depends on what kind of injury it's had. Bottom line is the spinal cord has a resiliency too. I mean, we're able to do so many activities, and the spine has a lot of motion, and yet it still protects the spinal cord. The problem is if you get into all these catastrophic, obviously, like what happened to Christopher Reeves was quite a fall. But by and large, it's pretty resilient too. I mean, I wouldn't call it so fragile unless it gets a type of trauma that is exorbitant.
Okay. So typically, when we're talking about healing something without medications or surgery, are we talking about something that's not traumatic as that? I mean, obviously, that's an extreme case.
Right. Now, there are cases like Christopher Reeves where clearly surgery is indicated. He had a very unstable spine. There are other cases where people have paralysis, progressive numbness, loss of bowel or bladder function. Those are clear surgical indications. I'm not really talking about those as much in the book. I do talk about them, and those are the ones where, look, there's no question the surgical indications are there, and they work very well for those indications. The vast majority of people suffering from back and neck pain, however, don't fall into that category. They fall into the category of folks who've had little injuries, they've been a weekend warrior, they have not been, on one side maybe they have not been as fit as they've been, then they go and they do something a little bit more strenuous. Or on the other side, there are even the very, I see a lot of folks with doing let's say CrossFit or some of these very, very strenuous exercise programs and don't do it with good form, those guys get the injuries. And also I'm talking about the folks that it's not just one injury that they've had. It's not that acute injury, because 80% of the population has that episode of back pain that's very severe at some point in their life. I'm talking about those people who become chronic back pain sufferers, and that's about 20% of the population. It's a pretty significant amount of people, and that population ends up being the ones who start having the anxiety, the anger, the lack of function, the feeling of desperation that leads them to using more medications, narcotic medications, and leads them to desperation of searching for a surgical solution.
And this seems to be like contrary, because you've got professionals that are in all of these sporting categories that are contact sports, and they seem to be able to take better care of themselves than the other 20% that you're referring to.
That's a very good point, and the reason is, one of the main reasons is because they are so fit. Because your body has a natural muscular and tendinous stabilization. I thought it's almost like a wonderfully designed corset that protects the spine. And if you have that well developed, the chances of you developing injuries is very low. And that's one of the big points that we stress in our clinics and even on our online program, giving folks the correct exercises to do to really strengthen the core, which is the key to injury prevention.
Well, you mentioned a corset, which falls into the line of clothing. If women don't wear brassieres all the time, would that have some effect? Because that is heavy.
Yes, it is heavy. I mean, so there are everything from being overweight has the weight of the belly, and also large-breasted females obviously have that forward pull of that weight that does affect it, but the corsets really, I'm talking about the natural corset that the muscles develop around the spine. Bracing, a lot of times people use braces to protect their back, but the problem with bracing, like external bracing, is the fact that it weakens your back muscles, and that's what you don't want to get stuck going down that pathway. I think you really want to use your own muscular stabilization mechanisms.
Wow.
I do have the phone lines open. Are you okay with taking phone calls, Doctor?
Absolutely.
Okay, let's go to the phone. Somebody's waiting patiently. Good morning. Thank you for calling and for waiting. You're on the air with Dr. Raiszadeh.
Yes, thank you. Doctor, is there anything in your program that can do something for scoliosis?
Yes. I have a echo on my side, but scoliosis is a very specialized side of therapy that has been more and more recognized. That there's a lot we can do with it. So scoliosis, just for those who don't know about it, it's a curvature of the spine, and it does result in an asymmetric pressure on your discs. And it can progress as one ages. It oftentimes starts in adolescence. And there are exercises that are scoliosis specific that are very helpful. And in fact, as far as adult scoliosis management, we do a lot of prevention of the big surgery, because if you want to correct scoliosis, it requires a large surgery to kind of cut the spine and fuse it together. And there are exercises that help you realign and also stabilize the spine where you can prevent that. So I do talk about those on our online program, and we do have for those who are not in San Diego, we have an online program with coaching that can progress folks through some of these more specialized programs. Like, scoliosis is a more specialized training program that needs a little bit more, needs more than just an online program. You need a little bit of coaching with that, and that's why we have that online program. So, and if you want some other references, there's a wonderful program that's Schroth, Scroth. She is a physical therapist who was in Germany and developed a very, very effective scoliosis program for therapy. So she has a book out. So that's also helpful. But your long and short answer is that yes, there are scoliosis specific exercises, but that is a very specialized area. So make sure you go to a good practitioner, or obviously you're free to come to our online program also with coaching, and we can do that.
Does the chiropractic field interface with what you do, or do you stay away from the chiropractic field? Well, a lot of people will go to a chiropractor if they've got backaches. What are your thoughts on that?
I think it does provide some good short-term treatment. My caution to anybody is that try not to pursue too many passive modalities, because you don't want to get hooked on going there, getting that crack, feeling temporarily better, and thinking that you constantly need that. Your body has mechanisms to do that exact, to get that exact feeling itself. So I don't think you need that. The thing I don't like about it is the dependency that some people develop with chiropractic. So if there's a short episode of acute back pain, sure, go to the chiropractor. I'm not as keen on neck manipulations, because I've seen some bad disc herniations that have happened after neck manipulation. But I think low back is safe, and I think in good hands you'll do well, as long as you treat it just for acute problems.
The book is called Take Back Control. Our guest is the author of the book, Dr. Kamshad Raiszadeh. The subtitle, A Surgeon's Guide to Healing Your Spine Without Medications or Surgery. We're up against the break, so we'll take the break. On the other side, I wanted to ask, could the book help the person who is on the line? He or she is deciding whether or not to get surgery. Would surgery actually make things worse? Because you hear those stories all the time. So let's take a little break, and we'll be right back. This is The Source, WOCA Ocala. Veterans are the foundation upon which our freedom is built. Listen to The Source, WOCA, each Thursday at 9 a.m. to Veterans News with Hank Whittier from Vets Helping Vets. You'll hear tributes, information on veterans issues, and stories that will make you laugh, cry, and feel proud. Veterans News always focuses on the military, past and present, and on our first responders. Veterans News is brought to you each week by Bob Wine's Camellia Gardens and Nursery, keeping you blooming since 1952.
The weather is brought to you by myfwc.com. Safe boating is no accident. Some fog this morning near the coast. Otherwise, it'll be partly sunny today. Nice and warm this afternoon with a high of 77 to 81. Then mainly clear Friday night, lows in the low to mid-50s. For Saturday, more sun than clouds. There may be a stray shower along the coast. The high 72 to 76. And for Sunday, partly sunny, high 76 to 80. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
All right, 21 minutes after 11 o'clock. Thank you for tuning in. Gosh, the one thing we want to make sure we take care of is our bodies. Our backs are so important.
Especially.
The spine, I mean, whenever you hear of an accident, you always, you pray to God that they didn't break their neck or cause themselves to be paralyzed. And we know a young man, doctor, who is in a wheelchair. He's the son of one of the guys who does a show here, and I think he's 19 or 20 now.
Yes.
So when he was like 11 or 12, I may have the age wrong, but he was in a motocross accident, and he's paralyzed, I think, from the chest down. Is that right?
Yeah.
He's amazing, and he's in a wheelchair for the rest of his life, but he's so good with the wheelchair that he's going to be in the Olympics, it sounds like, in 2020.
He can use his arms and everything.
Yeah, and obviously that's a little bit more extreme than what we've been focusing on. So would the book help the person who is who's not sure, surgery or no surgery? Does it help answer the question whether you should or should not get surgery?
Yes, that's really who it's written for, is for the patient to understand the different factors that you should consider prior to having surgery. Because as I was mentioning earlier, those who have chronic pain know exactly what I'm discussing here about the anxiety, the depression, the anger, the psychological side that accompanies chronic pain. But also, there are a lot of factors that you can address that can help you prevent surgery, like proper posture, proper sitting at a computer, proper transfers from sitting to standing, proper sleeping. So that's one side of things. Then there's nutrition. There are a lot of nutritional factors, getting to the ideal body weight, establishing good daily hydration, eating kind of heart and spine-friendly foods that are antioxidants that don't cause that inflammatory process. So that's a very important aspect. The other, and I cover all those aspects. The other is all the different problems that people think that, oh my gosh, I have a disc problem, I need to have it fixed. Mm-hmm. Well, I go through the fact that the vast majority of disc problems that you see, and even the MRI reports that say severe disc degeneration, are actually findings of aging that you do not need to fix. So I discuss all those factors. So those are important to know. So that's the complex part of the decision for surgery, is that there's a lot of factors that play into it, and I try to address all of those in the book and to try to empower patients to realize that you're not that far away. If you take little steps in this, there's not that far from being able to empower yourself to prevent surgery for standard back pain issues. And one of the greatest firsts I've found over time is how many spine surgeons have I known over the time? It's been thousands. How many of them have had spine surgery? I've known 3. So wow. It's very infrequent for those who know that they'll have surgery, and it's for those indications we discussed earlier, for paralysis or progressive, neurologic deficits or instability, those kind of problems. So, and we've shown that in our clinics too, that we've been able to prevent surgery 50% of the time, and there's a lot of there are studies showing that approximately 50% or more of the surgeries done today for back pain are probably unnecessary. So all these are a note of caution to the reader and to the general public that, take it slow, read about it, educate yourself. Don't take just one. Just don't take one opinion and in desperation make a decision that may not be a long-term good solution for you.
Well, marketing is a very, very powerful tool, and then you see advertisements that say minimally invasive surgery, and people are starting to jump at that.
Yes, and I really want to caution people against that. I think that this is a very, very important point. The fact that you'll see ads saying, just send me an MRI and I will tell you whether you need surgery, I think is a fallacy, because you are not your MRI. It's so much more complex. There has been a study of normal people who've never had back pain at different ages. And at age 50, there's a 60 to 70% chance that you'll have an abnormal finding on an MRI scan that you could easily operate on. So you really don't want to be fooled by just your MRI findings. You have to fit it with your symptoms and really try all the non-operative aspects that your body knows itself to heal itself.
The challenge with the radio show is to get enough information out there so that we can explain what the book is about. We'll never get the information in the book, especially in this case. It's really a comprehensive book, so we want the conversation to be a way for you to know that the book even exists. I'm talking to the listeners now. We do have a caller coming in, Doctor. Dr. Kamshad Raiszadeh is on the phone again. The book is called Take Back Control. Good morning. Thank you for calling and for waiting. You're on the air.
Good morning. I was just wondering how the book would help me. I have had an MRI on my back. I was having back problems, and they said something about possibility of a tumor on my backbone in that area of my spine, and they sent me to a specialist to read the MRI report. And when she looked at it, they wanted me to go for a contrast MRI. But when the specialist looked at it, she had me do all kind of movements and checked it to see what it said. And she said, I'm not really concerned about this. It looks like something that will correct itself over time. So that sounded like music to my ears, but does that sound like a good scenario?
it sounds like a phenomenal scenario in a lot of ways. I mean, there are a lot of tumors or masses that occur in the back that are completely benign that we just watch. There are cysts that can form around the joints. They're called the facet joints in the back, and we just watch them. There are other spinal tumors that are that don't grow. There's a finding called a hemangioma, which is kind of a group of blood cells. All those are completely innocuous, and you just need to watch them. So I think it's great that you went to somebody who was conservative, saying, this is not something that you need to treat. If you have a question regarding it, I would still seek maybe a second opinion. If you're still in the back of your mind say, well, I'm worried that maybe she's not giving me the right advice, but it's very common that findings such as this, benign tumors or masses in the spine, we just observe, and there's no long-term implications for them.
Oh, wow. Did you have a follow-up?
Do you suggest that I do go for a follow-up MRI? I hate MRIs, but, if it's something I need to do, I could do it.
Not if the doc does not think you need a follow-up MRI, no. If they are convinced about what it is, then there's no need. So I would listen to the doctor who told you, as long as they're, if it's a spine specialist who's told you that and can describe what it is and say, this is why I don't think you need anything, and they answer it to your satisfaction, then I would listen to that. If you know the name of the type of tumor, I can give you a little more information, but it's kind of broad right now. I don't know what the first people who had diagnosed that told you. So that's why I was saying that research whatever the type of tumor, whatever the finding is, and if you have any questions, get another second opinion.
And thank you for the call. We'll have to continue that off the air, but I wanted to thank you, Doctor, and make sure that the listeners know how to get the book. I have a copy of the book, so call me if you want the copy that was sent to me. The rest of us go to the websites. Let's say I have spinezone.com and takebackcontrol.com. Both are correct?
Yes, both are correct. And as I said, there also is an online program with coaching that folks, if they want to do, and I've a lot of free information on there, as well as if they need more help, an online with coaching program.
Okay. Dr. Kamshad Raiszadeh, thank you so much for being on with us today.
Thank you. Appreciate it.
You're welcome. All right, we will be right back.
Fox's Garrett Tenney, the French culture minister, says the Louvre in Paris will reopen tomorrow after a machete-wielding man's attack on a soldier guarding the museum.
Soldiers had stopped him outside the mall under the museum after becoming suspicious about the bags he was carrying. A military spokesperson said the soldiers first tried to fight off the suspect before shooting him 5 times, injuring him in the stomach. One of the soldiers was also lightly injured. Police say the man was carrying 2 backpacks and 2 machetes.
Fox's Kitty Logan. And police are testing drug-laced lollipops handed out by a student at a Pennsylvania charter school. They think a man gave her dozens to hand out. Fox News, we report, you decide.
HelloFresh delivers recipes and ingredients for a home-cooked meal in around 30